This is an event in what we call the Secretary Speaker Series. And the concept behind this is to bring leaders and voices from outside of state government into our agency to educate us. So let's first start off with Dr. Nooshin Razani from the Oakland Children's Hospital and really talking about the benefits of access and what it means.
Thank you for having me. So I study nature and health, and while indigenous and ancient cultures knew for a long time that nature is good for health, the medical society didn't really wake up to this fact until about the 1980s, when an important paper was published in Science that showed that surgery patients who had a view of nature had faster recovery time and less pain medicine use than those with a view of a brick wall. Since that time, there's been one other very important paper which looked at the entire population of England and showed that those who live in a greener neighborhood have reduced mortality at every income level, and that a lot of that difference was because of cardiovascular disease, which is something that's thought to be related to stress. So since that first paper in the 1980s, over the last 30 to 40 years, there has been an explosion of research looking at nature and health. And I'm not even talking about the research on parks and health, but we have been able to show an association with health outcomes over the entire lifespan, starting from the prenatal period and how a mother's health is, to the birth weight of the child, to things in childhood like whether you wear glasses or are obese, to outcomes in adolescence, in mental health, in adulthood, and then in the elderly period. There's also a whole bunch of research looking at not just the individual, but family and community health, and the fact that nature promotes social behavior and social cohesion, more opportunities for people across generation to have impromptu opportunities to be together, decreased crime and community mental health. There have been randomized trials of greening vacant lots that show that mental health increases when you just put a little bit of green in a neighborhood. And this doesn't even include the secondary benefits that happen in terms of climate change and other outcomes when you green a neighborhood. The way that we think nature improves health is basically through stress relief, physical activity, social contact, and fresh air. I don't think we understand it fully, but these are the mechanisms that we've been really drilling into. And nature does also improve environmental stewardship, as you know, active care for the environment, a love of nature, and the passage of indigenous and cultural practices, which I would argue are also part of human health and our future as a species. So with all that in mind, with this explosion of research, in 2012, my hospital, which serves an indigent population in the East Bay and is a safety net hospital, was approached by our park agency, which is East Bay Regional Parks District, and we were asked to write nature prescriptions. And in the beginning, we really pushed back against this because the disparities in access to and use of outdoor areas and nature are basically the same as disparities seen in chronic illness. And so on this slide, you'll see up on the upper right corner is some work done by Alameda Health County that shows that even a mild difference from where you live in Alameda County can dictate a 10-year difference in lifespan. And if you put zip code and race and ethnicity together, that's a 14-year difference in lifespan, depending on where you live. Coincidentally, the next map is by Trust for Public Land, and it shows access to parks in the East Bay. If you overlay those maps, they're similar. You have a longer lifespan where you have more access to green. And then the third map is from the EnviroScore, which shows toxicity and pollution. And so what you see is the same people who are dealing with multiple health issues are the same people that don't have access to green space, who are the same people who are suffering from environmental injustice. And so the thought that a piece of paper from a doctor to go outside would solve the whole problem was quite funny to us as providers. This is I just wanted to get into the issue of access a little more. This is an amazing study of the entire United States and the percent vegetation. And if you look at this picture, the green is actually white race. And as you get to higher percent vegetation in a neighborhood, you see how much the percent is of white race. And this is independent of income. And so in general, in the United States, census tracts with a higher proportion of racial or ethnic minorities have less green. We ourselves did a study of the United States looking at park access, and out of about 50,000 children, first of all, most kids said that they had access to a park. The yes parks, sorry, it's messed up, but is about more than 75% of children have access to a park. Not having access to a park was associated with all kinds of bad health outcomes. But it was interesting because poverty and living in a rural area were associated with not having access to a park, whereas race was not. And so these two slides I want to tell you kind of point out, first of all, that nature is not always the same as a park. Because for populations who are minorities, often the parks that they have access to have less green space. And then the second issue is that spatial access or distance to a park is different than social access. And so just because a child has a park near them does not mean that it's a park that they feel comfortable going to or will play in. So with all of that in mind, first we told our park district, that's ridiculous, and why don't you bring nature to us instead of us writing a prescription? And so we asked them, they did actually listen, and they decorated the inside of our clinic with maps and visuals of nature. And then we said, yes, we will bring our patients to nature, but we want to actually bring them. And we need transportation, we need food if you want people to be together for 3 to 4 hours, and children need to be able to bring their families, because this is a behavior that needs to live on in the community after this one-time outing. And the amazing thing is that our park district listened to us and they maintained the relationship. And so it's now been 5 years and more than 75 monthly outings and thousands of children and their families who've gone out into nature for often the first time. And what we did is we addressed the barriers, but we also saw the opportunities. And the opportunities that we saw, first of all, were that while people did not really want to talk about physical activity or obesity at all, they were quite interested in trauma and stress. And by listening to people, we really developed programming that reflected their needs. We also found that family and kinship and culture were a huge opportunity to engage people in our programming. The next thing that we did was evaluate. And so there is plenty of evidence already and plenty of health outcomes that can be followed. And because we believe that nature is evidence-based, we conducted actually the first randomized trial of a park prescription. And what we found is that every time a family went into a park, there was a incremental decrease in stress in the parents and improvement in resilience in the child. And the cool thing, which wasn't that great for our program, but was that it didn't matter if they went with us or on their own with their families. And so while we would love to think that we're central to communities, we're actually just their doctors, and they don't actually need to be with us out in nature. But that means a lot for you. And so what I wanted to do is to flip the script a little. And instead of talking about how parks can partner with health, or natural resource agency can partner with health, I wanted you to understand that you are a health intervention. This is public health. Having natural spaces and programming in nature is public health. And so because of that, I think the vision should be bigger, and you should be dreaming bigger. And rather than only thinking about how do we give people a discount on getting into a park, you should be thinking about how do we eradicate health inequity. What is our role in dealing with the mass trauma that's happening in our population right now? And if you think that way, then you need to approach public health departments and hospitals not by saying, can you please come on a panel, even though I'm really happy to be here, but can we co-develop a task force that really thinks about how do we improve the health of our communities? Because I really need to break it to you, it's more than through one visit to a park once. But how do we develop programs and measurements that really address the health inequities which are bringing our population down? And this little circle that I'm showing you is from the tons of material that's written in the health department. This is from the California Department of Public Health on how healthcare providers should be engaging with community partners on eradicating health inequity. You just need to plug into that as really, I think, one of the most important community partners. No one is talking about solutions. Everyone talks about problems. Nature is a solution. You have a solution. So I think you should think of yourselves as healthcare providers and take yourselves as seriously. And just like our health department did, listen and respond and don't go away after one outing. And we've been thinking very systematically about how to get people into nature. And it's the nexus of a lot of things like civil rights, environmental justice, anthropology. It's not simple, but that's okay. Like, we can lean into it together and learn about it. And then finally, this is from an outing that I organized with my own community. I'm Iranian American. Last week was probably one of the worst weeks of my life. And this weekend we went out into nature, and we needed it. And so what I want to ask you is, are you ready for all the traumatized people that are coming to your parks? What are you going to treat us like when we're there? Are you ready? Because you are a public health intervention. You're saying you want parks for all. Have you built capacity? Are you trauma-informed? What do you do when you see homeless people? Do you call the police? Are you ready for all what's going on in society? Well, this is an invitation for us to work together to deal with these issues and get ready, I guess. Thank you.
Thank you, Dr. Razani.